So let's talk about how safe the different approaches to weight loss are, comparing medications like semaglutide versus a procedure like the gastric sleeve. Because the use of semaglutide and tirzepatide is something that is new, we don't have long-term data to say exactly what the long-term side effects are going to be. So that's kind of an unknown risk at the time. However, in the short term, we do know that besides nausea, vomiting, and occasional bloating and constipation, a small percentage of people on the medications are at risk for developing aggressive thyroid cancer known as medullary thyroid carcinoma. There have also been several cases of chronic gastroparesis with the weight loss medications, which basically means the stomach doesn't empty properly, and that can lead to a pretty debilitating issue, making it difficult for you to digest your food and in turn having a pretty miserable outcome. As far as the gastric sleeve and gastric bypass are concerned, there is less than a 1% risk for major complications with the surgery. Having done thousands of these procedures myself, in my experience, nausea usually lasts for about a day or two in most cases. And in general, most people within a month are safe from having any long-term issues with the procedure. All in all, in my experience, most people for the short term tolerate both medications and the surgical procedure very well. However, I'm not sold on the long-term use of the medications because it does affect the endocrine system and the hormones in our body. And so we don't know what that means in terms of complications down the line. Furthermore, chronic gastric emptying issues such as gastroparesis and potentially developing medullary thyroid cancer are very serious issues that must be considered when taking the medications for long term. I'm hoping that helps clarify things a bit. Thank you.